name still remains the same, Esther. Today we're going to be looking at epilepsy. And what are epilepsies? Epilepsies are a group of neurological disorders that are characterized by the occurrence of seizures. After headache, the most common condition treated by neurologists is epilepsy. And what does that mean? That means that about 4% of the population are going to be experiencing epilepsy sometimes in their lifetime. Now, what is seizure? Seizure is the sudden burst of abnormal electrical activity of the brain, which is caused by an imbalance between excitation and inhibition of the central nervous system. This inhibitory mechanisms means the braking system of the brain. Now let's look at types of seizures. Number one is focal seizures, which is also known as partial seizures. This starts at one part of the brain. It is subdivided into two, which are focal seizures with impairment of consciousness and focal seizures without impairment of consciousness. Focal seizures without the impairment of consciousness means that the person is aware during the attack of these seizures. So it is usually sensory or emotional experience, and it can also involve jerking on one side of the body. Auditory, visuals, and other parts can also be involved during the attack of this particular seizure. Now, when we are talking about vocal seizures with impairments to consciousness, we are saying that this person is conscious, however, he or she is not aware of their surroundings. That is, they lost a complete touch with their environment. During the attack of this particular type of seizures, there may be repeated movements like lip smacking, rubbing of hands, or fumbling with their clothes. The second type of epileptic seizure is generalized seizure. This involves the both parts of the brain. We remember that the focal type only involves one part of the brain. However, this generalized epileptic seizures involves the both hemispheres of the brain. Additionally, it is subdivided into two. The first one is absence seizures. This is a non-convulsive seizures which consists only a few seconds of unconsciousness. For example, blank staring and immobility, the eyelid may flutter, and at the same time, this person has no memory of this particular attack. The B part of generalized seizure is tonic-clonic seizure. This is a convulsive seizure which involves the whole body and at the same time a loss of consciousness. It consists of first stiffening and then jerking, and at the same time this person has no memory of this particular attack. Now let's look at epileptic syndrome. So epileptic syndrome is a little bit different from epileptic seizures. In epileptic syndrome, there is a probable time for the onset. At the same time, there is a diagnosis for it. There is a possible cause for it. Also, response to medication is predictable. There are two well-known types of epileptic syndrome. The one is Lennox-Gastaut syndrome and West syndrome. West syndrome begins to show its symptoms in the first year of life, while Lennox-Gastaut syndrome begins its symptoms between the ages of 1 to 8 years. Both could involve drug-resistant seizures, and there is mild to severe developmental delays when it comes to epileptic syndrome. Now, what are the causes of epilepsy? We have brain damage or injury, we have genetic factors, we have brain infections, there is structural brain abnormalities, when there is problem during childbirth or early childhood. There could also be metabolic or medical conditions. So these are the various causes of epilepsy. Now let's look at what to do and what not to do during seizures. So what can we do? If it is a convulsive seizure, that is the person is shaking and there is a loss of consciousness, the number one thing to do is stay calm. As a primary giver, there is a possibility of you to be nervous. So the first thing is to comport yourself and stay calm. So the second thing is to know the time that the seizure starts. So what time does it start? You have to note it. Then protect the person from injury. You can remove chairs, tables, or any sharp objects around that person. Anything that you know that will cause an injury to the person. The next thing to do is cushion their head. If there is pillow, you can fold your jacket. If you have a jacket on you, you can fold your jacket and position it at the back of their head, so that when they are shaking, they will not injure their head further, to prevent fatal injury. You can help them to lose their tight clothes, especially around their neck. The most important aspect is stay with them until they regain consciousness. If this is outside, you can call 911 immediately, and if this is at home, make sure you call 911 after 5 minutes of the seizures. If you are seeing that the seizures is lasting more than you expected, if the seizure is lasting more than 5 minutes, make sure you call 911. Now let's look at what not to do during seizures. Do not restrain them. A lot of people want to hold them because they are shaking. A lot of people want to restrain them. Do not do that. Another thing is, do not put anything in their mouth. Some people put spoons, some people put their medication, some people put food, some people want to put water. Do not give them anything by mouth unless they regain consciousness. At the same time, do not perform CPR unless that person is not breathing. If the person is not breathing, you are free to perform CPR. But in as much they are breathing, do not perform CPR. What can we do after the seizures is over? Number one thing is check if they are breathing properly. So if they are breathing properly, no need for CPR. If they are not, please begin CPR immediately. Another thing is, if they are breathing okay and they start to regain consciousness, you reassure them. You tell them everything is under control, they are okay, and they will be fine. After seizures, the individual involved may be embarrassed, they may be tired, they may be confused, or they may even have headache. So the only thing we can do to help is to allow them to rest. You can help them to sit up, so we will give them enough time to rest. Epilepsy is not contagious. When you see somebody having seizure attack, you can call 911 immediately and also help them. Thank you very much for listening. Make sure you subscribe, hit the like button, follow, and make sure you share. Thank you. Have a good day. Bye-bye.